Diseases of the oral and pharyngeal cavities and ileus. The overview of the oral cavity. And then you look at the periodontal diseases such as feline ontoclastic resorptive lesions, or FO-L. The second disease is stomatitis. Talk about the systemic diseases, immune-mediated diseases, traumatic, infectious, and feline gingostomatitis. And then, most importantly, feline eosinophilic granuloma complex, or FEGC. Thirdly, talk about the diseases of the tongue. Fourthly, talk about oral neoplasia. Discuss melanoma, squamous cell carcinoma, fibrosarcoma. These are the malignant tumours. And also epulitis and papillomatosis. These are the benign tumours. Then also talk about the diseases of the salivary glands. For ileus, talk about mechanical ileus when the lumen is blocked, functional ileus when peristalsis is stopped, and also intussusception when there's an invagination of the intestine into the other parts of the intestine. Then talk about CO, small intestinal obstruction. Talk about the symptoms and the types: obturation, intussusception, linear foreign body, mesenteric torsion, strangulation, and paralytic ileus. And the surgeries: enterotomy, resection, or also called as anastomosis, and enteroplication. So the symptoms of oral disease are oral pain, dysphagia, which is difficulty eating, interest in food or appetite, so a reluctance to eat, salivation, halitosis, which is bad breath, and blood-tinged saliva, and blood on toys or toothbrush or food dish, facial swelling, and nasal discharge. Then you examine the teeth. So in dogs, say 3142 on the top and 3143 on the bottom. Cats, say 3131 on the top and 3121 on the bottom. Look at the number of teeth, the shape, the surface, any tartar, pain, movability. And for the tongue, look at the shape, size, surface, is it intact? Look at the papillae, the colour, the consistency, and the movability. The gums, look at the colour, the moisture, and the intactness. And the salivary glands, look at the size, surface, and colour. Dysphagia can be from oral pain, such as trauma, fractured teeth, periodontitis, and gingivitis. Pain when swallowing can be an esophageal stricture. The dysphagia can also be caused by mass, such as a tumour or granuloma. Or there can be a neuromuscular disease. So periodontal diseases. So gingivitis can become periodontitis. It's common in older, small breeds. What can predispose an animal to this are malocclusions, non-abrasive food, such as soft food, and a rough tooth surface. So basically, teeth normally have a microbial biofilm surrounding the tooth, and it's a normal defense for the teeth. But bacterial plaque can cause the change of the bacterial flora, which leads to toxins and inflammation. This inflammation can lead to gingivitis and tartar. This can cause a loss of the periodontal ligament, which can lead to tooth loss. Gingival sulcus can increase due to the inflammation, which causes a periodontal pocket. The clinical signs are halitosis and discomfort when eating, and blood-tinged saliva. And there can also be chronic ulcerative periodontitis, CUPS. The treatment is to aim to remove the supra or subgingival plaque and polish the teeth, and if it's end stage, you extract the teeth. Before and after the dental treatment, give anaerobic antibiotics such as clindamycin and metronidazole, and amoxicillin. For prevention, practice good oral hygiene to prevent plaque formation, such as toothbrush, dental hygiene, and chew toys. The main periodontal disease is feline odontoclastic resorptive lesions, or FO-L. The new name is tooth resorption disorder. It happens when odontoclasts from the vessels of the periodontal ligament and alveolar bone are stimulated to reabsorb the tooth structure. You can have an inflammatory form, which is due to the periodontal disease. It's painful. A non-inflammatory form, it's when the reabsorbed tissue is replaced by the bone tissue. It's not so painful. And for the clinical signs, it's common, up to 70% in older cats, especially Persians. Symptoms are they have a reluctance to eat dry food, and it's painful when they eat. And hyperplastic gingival tissue covers the resorptive lesions on the crown. And since it can be covered by plaque and tartar, you need to put the animal under anesthesia and do an x-ray. Extraction is usually the solution. The second oral disease is stomatosis. It's inflammation of the mucous membranes of the mouth. The clinical signs of stomatitis are anorexia, dysphagia, salivation, drooling, halitosis, and local lesions such as reddening, erosions, and ulcers. So the first type are systemic diseases. They can be endocrine or metabolic. The first type is uremia. This is a result of urease positive bacteria can cause ulcers in the oral cavity. Also diabetes. The next type are immune-mediated diseases. These are lesions that are localized at the border of the mucous membranes, such as pemphigus foliaceus. The next type are traumatic or physical chemical injuries. These can be foreign bodies or chemicals, such as acids or heavy metals or pesticides. Stomatitis can also be caused by infectious diseases, such as the feline calcivirus, FIP, and feline panleukopenia virus. And leptospirosis, any disease leading to thrombosis, exaggerates stomatitis. For the diagnosis, you can check the blood, do an oral swab for PCR, or do an oral biopsy. The specific types of stomatitis are feline chronic gingiostomatitis, feline eosinophilic granuloma complex, ulcerative stomatitis, which is found in Maltese and Cavalier King Charles. For feline gingiostomatitis, so it's inflammation and proliferation of the gingiva and mucous membranes of the oral cavity. It can be idiopathic or hypersensitivity reaction. The feline calcivirus can exacerbate the process due to immunosuppression. It's commonly found with feline odontoclastic resorption lesions. The clinical signs are halitosis, dysphagia, and discomfort eating, pain, and gingivitis. It first starts off caudally and then becomes rostral and then becomes chronic. If it's unilateral, there's a high chance of a tumour, and expect to see enlarged mandibular lymph nodes. For the treatment, you can extract all the teeth, and after the surgery, give clindamycin. Next, we're looking at a syndrome called feline eosinophilic granuloma complex. It's not a disease, it's a syndrome. The eosinophilic infiltration is common in the oral cavity and lungs, but when it becomes extreme, think of allergies. It comes in three forms: oral eosinophilic ulcers, eosinophilic granulomas, and cutaneous lesions. The etiology is unknown, but it is immune-mediated. It's a hypersensitivity reaction. It could be to food, fleas, atopia, or infective agents such as bacteria, viruses, dermaphytes, scabies. The clinical signs are dysphagia, salivation, and pain. For the diagnosis, look at the clinical signs and do a histology. Do a deep biopsy to distinguish from neoplasma, as the differential diagnosis can be neoplasia or foreign body reactions or mycotic infections. The treatment is to remove any underlying causes and have them on a hypoallergenic diet. You can give glucocorticoids like prednisolone tablets, but the main treatment is a cyclosporin at quite a high dose. This is the proper treatment, but you can't start with this. Next, we have the diseases of the tongue. Glossitis is inflammation of the tongue. It can be superficial or a deep ulcer. The causes are infectious diseases, immune-mediated chemicals, or metabolic diseases. Then we can have strangulation of the tongue due to ingestion of a tracheal ring of poultry, linear foreign body, or a foreign body in the root of the tongue, such as a splinter. And we can also have neoplasm, trauma, and congenital microglossia. Next, we have oral neoplasia. The malignant tumours are malignant melanoma. It's the most common malignant tumours in dogs. Then you can have squamous cell carcinoma. It's the most common malignant tumour in cats. And fibrosarcoma. And then the benign tumours are the epulides. They're the most common benign tumours in the oral cavity. And then we also have papillomatosis in young animals, caused by COPV1. Next, we have the diseases of the salivary glands. So we have a sialocele, which is a painful swelling due to a salivary gland rupture. The treatment is surgical removal of the salivary ducts and glands. The next disease, we have a sialodenitis, which is an inflammation of the salivary gland. It can be infectious or non-infectious. And the treatments are glucocorticoids and antibiotics. For ileus, it is a disruption of the GI activity. The classifications are mechanical ileus, which is when the lumen is blocked. It can be intraluminar or extramural or intramural. And then you have functional ileus, also known as paralytic ileus. This is when peristalsis has stopped. It can be paralytic ileum, or it can be vascular bowel disease such as thrombosis or shock, or it can have a spasmic bowel. The therapy is metoclopramide and neostigmine. And you can also have a foreign body ileus such as bones or a hairball or a string. The string is a linear foreign body and the hairball is a trichobezoar. For foreign body ileuses, the impaired peristalsis leads to vomiting. And the abnormal movement causes bacterial overstimulation, which leads to dysbiosis. Foreign body ileus leads to dehydration, hypovolemia, and hypophosphatemia, which leads to weakness. And endotoxemia. Foreign body ileus is normally found in young large breeds. In the diagnosis, expect to see a lack of appetite, vomiting, dehydration, and potentially shock. For a linear foreign body, which can be a string, expect to see a punching of the intestine, and there's a very high risk of septic peritonitis. When diagnosing, use an ultrasound. Expect to see unusually wide loops. Impaired peristalsis has a pendulum movement, so when there's a peristalsis effect, there's actually an anti-peristalsis effect. The next condition is intussusception. It's an invagination of one part of the intestine into the other. It's most commonly found in puppies, and it's usually ileocecal. When doing an ultrasound, the target sign are multiple concentric rings of the intestinal layers. And the treatment is surgery. So the treatment of ileus, you have the preoperative treatment, which is usually giving fluid therapy, usually a crystalloid and potassium. This restores homeostasis and rehydrates the animal. And for surgical management, it has to be done as soon as possible. You do a laparotomy and you do a resection, also known as anastomosis. It involves removing the necrotic parts of the intestine. For post-operative care, you have to have enteral feeding as soon as possible. You need to feed the enterocytes so they recover. Give 25% of the resting energy requirement, low fat and high digestibility, and you can do syringe fed tube fed, and be careful of aspiration. The general symptoms of a small intestinal obstruction are abdominal pain, vomiting, a lack of feces, and meteorism, which is gas accumulation. It can be seen well on x-rays. The types of small intestinal obstructions are obturation, intussusception, linear foreign bodies, and mesenteric torsions, adhesions or strangulations, and paralytic ileus. And the different types of surgeries, so you have resection or anastomosis, so 80% of the small intestine can be resected without a short bowel syndrome. And the indications are necrosis, ulceration, or tumours. The resection can be end-to-end or side-to-side. And then you can also have enteroplacation, which is a special technique to prevent recurrent intussusception.